Here's just some numbers of death rates in the United States in 2018. The first thing you have to notice is they put the deaths per 100,000 of the US standard population. This is kind of the standard that people use for data for populations. What's interesting about that is when they do it for the coronavirus, and here's the Worldometer page. For the coronavirus, when they look at the death rate, they don't do it per 100,000. They do it per million. It's death per million population. And I don't know why they do it per million. I'm assuming it's because some places would be too small. Like you'd have to have Russia's 0.5. Brazil would be 2 deaths per 100,000. So they do it per million, possibly to make it for awareness. I'm not totally sure on why they changed the way they record the data. Okay, but this happens all the time. But let's just look at the data for regular death. Now, remind you, per 100,000, the death rate for COVID in the United States is 16. It's 16 per 100,000 right now. Suicide is 14 per 100,000. Kidney disease is 13 per 100,000. Influenza pneumonia is 14 per 100,000. Remember, COVID right now is 16. Now, it's not going to stay at 16. It's going to go up. And we know it's going to go up. Diabetes is 21 per 100,000. So right now, diabetes is a bigger killer in the United States than COVID is. Stroke is 37. Now, if this is per million, that would be 370 per 100,000 die from strokes. Again, when we compare the data, again, COVID is 16. Let's look at these numbers. And then you get to cancer and heart disease. Holy cow. I mean, the rate of death it's nowhere near here. Now, we hope it doesn't get as high as cancer, but even if it does, even if it were as high as cancer, if cancer was preventable by shutting down the entire everything that we do in America, like there'd be no more cancer, literally. Like we just eliminate everything. We're just on lockdown forever and cancer goes away. Would we choose to do that? If with the cancer rates it is today, if you said, well, if you keep going to these concerts and living your life free, you might get cancer. I'd be like, all right, well, I guess I'm just going to have to take that chance. I would just have to take, I'm sorry, I just would. I would just be like, I'm going to take the chance. And if I get cancer, hopefully I battle through it. But I'm certainly not going to I would not just shut down my life forever just because I might get cancer. And remember, COVID is not there yet. COVID is not at that number. We don't know. COVID right now is not even at the number of a stroke. So let's just say it's a stroke. Okay. If you go out and live your life and go to restaurants and go to the gym and go to the concerts, you might have a stroke and die. And remember, the risk of stroke is the same as it is today. I'm not just staying in my house. I'll be like, all right, well, let's hope I don't have a stroke. And if I do, let's hope I survive. That would be the way I approach it. I'm not saying that's right or wrong, but that's what I would do. But these numbers just aren't represented yet to do what we've done. And as I was looking at the numbers, and this is what got me into it was Belgium has the worst cases. I don't know if anyone's aware of this. Belgium is the absolute worst. This is a European website. It's not American bullcrap politics. Why does Belgium has the worst COVID death rate? And I was interested in this, and I'm like, how come? It has the highest per capita death rate in the world, almost 4 times that of the United States. You won't hear that on the news now. You're not going to hear how bad Belgium is on the news. And they talk about getting criticism. This is Dr. Steven Van Goot, head of the Viral Disease Division at the Public Health Institute. He says if you want to compare numbers with a lot of other countries, you basically have to cut them in half. 95% of COVID deaths in elderly care homes have not been diagnosed. And the deaths in nursing homes account for 50%. In other words, Belgium at this point is just kind of counting the deaths. Hey, there are people are dying in nursing homes. It's an impact in the nursing homes. We know this. It's a disaster, they're saying. this is what's really interesting is where are these deaths coming from and how are they being counted? We know that's an issue. And we know they're starting to now count. Spain had to adjust its historical data this month to include people who had symptoms but did not test positive. What? So now they have to include people that we haven't even tested yet. Germany's unusually low mortality rate may be helped by the fact that it counts only deaths that have a positive virus test result. So when you're looking at these numbers and everyone has been praising the numbers of Germany because it's led by a woman, and you find out, well, they only count people that have died with a top positive test. Where Belgium, who has a super high death rate, the highest in the world, they're counting everybody, just if you had a symptom. So look at their death rate. And Spain started to do that now too. And USA, and we're down to number 15. You're not going to hear this on the news. You're going to hear garbage on the news, how America's the worst. It's like, no, sorry. I mean, unless you want to discount Belgium, Spain, Italy, France again, but I don't want to get into that. So what are we what's going on? So here's the Washington Post: nursing homes linked to up to half of coronavirus deaths in Europe. Half. And this is what's important to me is, has what we've done helped? What did we do with the nursing homes? We basically said, okay, no one could come in, no one could come out. No visitors. And then half of the people, like dozens of deaths in these places, no visitors. And anyone that's ever visited a nursing home, a lot of them, they're pretty shady. It's like, yeah, I don't know that I'd want to go there. A lot of them, I'm not saying all of them, and I'm not saying people aren't doing their best that they can. I know the resources at nursing homes isn't fantastic. I know they're super expensive. I know workers don't get paid very well. But this is very concerning. Up to half of coronavirus-related deaths in Europe are occurring in long-term care facilities such as nursing homes. This is from the WHO. An assessment that suggests public health authorities may have allowed the pandemic to rage among some of their most vulnerable populations as they focused on hospitals and other aspects of their response. Other aspects like making sure no one can go to the gym, making sure kids aren't in school, making sure restaurants are closed down. Meanwhile, the place where most people are dying, no resources went there. Now imagine if, just think for a minute, if we just changed what our focus was and focused on where the actual problem is, if things could have been different. I think we're going to find it out as we move forward. I think we're going to find out that we messed this up. We made mistakes. We're going to continue to make mistakes. And this isn't just a European tragedy. And here's the thing about the nursing homes. These people are dying. They can't even have visitors. No visitors. Because you might get people sick. Meanwhile, they're dying inside the nursing home. It says many countries in Europe have essentially ignored coronavirus testing in nursing homes to focus their testing capacity on hospital patients and hospital staffers. I mean, this is outrageous to me. It's outrageous that we're letting our elderly die in nursing homes, but we shut the gym down so that I can't get it. I don't understand how we do that. Here's another article. Can we trust Belgium's COVID-19 death statistics? This is Euro news. This isn't, anything crazy. This isn't some conspiracy theorist. This isn't Alex Jones. These are the questions that people have around the world that our propaganda news media isn't going to ask. They don't ask these questions. They're not interested in news. They're interested in bullcrap Trump nonsense so they can make their money. So here in this article by Euronews, they think Belgium is being too honest and overestimating the country's death toll. They think Belgium is providing us with a more accurate reflection, if one that is a little exaggerated, of what's happening compared to other countries' figures, which do not seem to be telling the full horrific story. We don't know the story at this point. We don't know. I mean, where are the people dying from? And I had an interesting thought. You have nursing home people that working nursing homes. They don't often get paid very well. And now you shut down all the schools and everything, so now they can't even go to work. I'm curious as to how many people in nursing homes haven't been able to work because of childcare, because of people at home. I don't know that that's an issue, but it very well could be. And I'm just curious. Well, of all our deaths, how many people come from nursing homes? And here's a study. This is an older study. It's October 2008. But in the United States, 20 to 24% of deaths occur in nursing homes. This is just overall deaths. And it just made me think, it's like, we're panicking because people are dying, which this is known as life. And that may sound harsh and that may sound cold. I'm not trying to be. But what I mean is, when you're at the end of your life and you're in a nursing home, unfortunately, things like the flu and things like this new disease can kill you. Those things are serious. You don't get pneumonia when you're 88 and just, cool. That might mean death. And it's a scary time. And you're in a nursing home for a reason. You're not in a nursing home because you're a vibrant, active, 88-year-old running around shopping still for yourself. You're usually there because you need help. There's probably some other sicknesses. You're probably on a lot of different medications, because we know in our country, everyone's on a bunch of medication. I mean, could you imagine if I looked that up? So yeah, I mean, we look at the date of people that die, and or the age of deaths. This is a disease that is affecting. Here is in Italy by age group. I'm in this age group, 0.9% chance, or 0.9% death rate. That's if I get the COVID. That's if I get it. I have a 0.9% death rate. And here we are, look, you got 10 to 9, 0%. I don't know if that means they've had no deaths from 10 to 19-year-olds down there in that age, but 0%, 10 to 19, your school age. Literally none. Here's where the deaths are. You're over 70, man, don't go out. It's just dumbfounding to me that we just decided to just shut everything down. Give it up. It's over. And we're going to do this continually. We are going to keep schools closed down because of all these deaths here of the 80 to 89-year-old. That's what we're going to do. That's our plan. All right. We're going to close down the economy because everybody has to. Well, how about this? How about we might have to socially isolate here. We might have to take extra precautions here. We might need to have masks on, have someone else do your shopping. Let's wipe things down. Let's keep things clean and see what the results are. But you're here. You can't go to the gym. They can't go to school. And I've got a question. Has this worked? Is it working? Where's the evidence? Where's the evidence that anything that we've done has been working? That's what I would like to know. Where's our evidence at? I mean, we've got everyone spouting out facts and fact checking everything. Where's the evidence that it works? I mean, here we've got Sweden. From my understanding, Sweden really didn't shut down. And guess what? They're just like everybody else. They're no different. The same stuff, same cases. It's called a disease. Apparently, we did everything wrong. Okay, but we're down here too. Like this isn't you know, I don't know what people think. This is called a disease. Like this isn't like, oh yeah, we could just prevent the disease. What I mean, anyway, getting off topic a little bit. But again, what did my research start with? Started with the death rates of people and how we don't understand big numbers. And we don't understand that people die. This is a lifelong thing that people die. And my next show is going to be about that. It's going to be about what it means to be free and to take the risk of dying. So again, I ask you, if any of these things were random that you can catch, and a lot of things, these things are, look at unintentional injuries, for God's sakes. Unintentional injuries has a 494 per million death rate. Remember, COVID has a 16. Can we reduce all these deaths if we just shut down everything? Yeah. Is it worth it? Is it worth it? Is the question. Why? I think it depends on how old you are. Huh? I'm 86. I might be keeping my butt at home for a while unless something changes. That's not worth it for me. I'm going to read my books. I'm going to watch my Netflix. I'm going to talk to people on the computer. I'm going to hopefully got some people that are going to wash their hands and visit. We'll visit outside. We'll social distance. I get it. But I'm 21. I can't go to college anymore. We're just, that's it. The data matters. The facts matter. Okay. Everyone wants to spout facts. And then a second you say something about their facts and all of a sudden their feelings get all into it. Oh, you don't care about people. I care about people. I definitely care about people. Everybody. I mean, that's such a silly statement. And that's why I have friends who they have older people in this age group at home. And I understand that they don't want to go out and risk bringing that home to them. I understand that. I support that. 100% right. Good for you for not being selfish and not thinking of yourself. And you know what? My grandma's in this age group. I can't go visit her right now unless I get tested. I understand that. I'm aware of that. But we can't just lock down the country because you don't know if you can trust me to not make good decisions. Meanwhile, my mom, who's in this age group, who's in the 60 to 69 age group, she is shopping for the 90 and older age group as if you can't catch it at a store. I don't know. I've got way off track a little bit here, a little bit of ranting and raving on this one, but it just drives me crazy that we pretend we have all the facts and we don't. The facts aren't out yet. That's one of the things that you have to realize here is that we actually don't know. We're going to know a lot more in the future, but what we can kind of do know is that does our government have the right to say that you can take no risks anymore? So look at these numbers. I'm just going to just close it up with thinking about the numbers. The death rates of unintentional injuries is 494 per million. And a death rate for COVID right now in the United States is 160 per million. And I'm going to argue, even if COVID gets to the rate of 490 per million, unintentional injuries rate, which are accidents, okay, what that would mean is about 150,000 people per year would die from the COVID. Is it worth it to shut everything down still? Or do we want to take a chance? Are we willing to just, you know, go with it? That's a question you got to ask yourself. What's it worth? What's freedom worth to you? What's living your life worth to you? Life's a risk, man. You got to live it. You got to live it. And there's no guarantee. There's no guarantee that I'm not going to be one of these numbers in here. We're going to put it, we got a new one coming up in here too now. Now it's COVID, new risk. That don't mean I want to quit living. Man, I'm not done living. How about you?